of HIV justice worldwide. And we have, partners active in Europe, North America, Latin America, Africa, Eastern Europe, Australia. I'm currently calling today from France. I'm in lockdown in Paris, so I can also have this European perspective. In Europe, we had at least 20,000 people who died. HIV Justice Worldwide on Wednesday released a statement on COVID-19 and criminalization. We were really concerned about what we were seeing happening around the world, as states grapple with this, this crisis and are really tempted to take very drastic measures. We've seen, more and more restriction of our liberties with attached penalties for those who do not respect the measures, increased police surveillance. We also seen some specific legislation drafted to criminalize COVID-19 that happened in South Africa, and it's really poorly written. And we are seeing emerging cases, including in Canada, against people who have allegedly exposed others. So that, of course, is of great concern given, what we know about the impact of criminalization on public health response and the importance of maintaining human rights at the center of the response. So we hurried to basically put together a statement to warn states against this temptation to use criminal law and coercive measures to limit the spread of the virus. And in this statement, we share our experience of HIV criminalization and how it has had negative impact both on human rights and on public health, and how this has not worked to limit HIV, and how it has disproportionately impacted the most marginalized. And we warn against also specifically, hastily drafted legislation and any application of the criminal law that would be driven by fear and panic, because we know that in those circumstances, it's unlikely that it will be, really respectful of human rights, scientifically based, etc. Again, learning from our experience, and we are urging states to put human rights at the center of the response. The statement exists in French, English, Spanish, and Russian. It's available online. I'm happy to circulate if people don't have it yet. And I just wanted to also mention that in the statement we highlight a document by UNAIDS around the human rights approach to COVID-19, based again on the HIV experience, and it's a good document. It's helpful. And so as Alex mentioned, now we at HIV Justice Worldwide, we are trying to monitor cases of criminalization in relation to COVID-19, and we are sharing this on our newsletter. And so if people are interested, that's a good source of information.
Thank you, Cécile. That was excellent and helpful. I posted a link to the statement in the chat so people can see it. And there you can also, I think, get access to the UNAIDS document. Okay, so what is next? Baj posted in the chat just to highlight, and I think this is one of the fears that people have been having, is that police using violence to enforce forms of social distancing. So I know in India there was a case of a man beaten by police who went to buy milk during his quarantine, and he ended up being he arrived at hospital dead. So he was beaten to death by police, and this is a fear that I think people have of just how policing will be ramped up in different ways in all over the world. So we're going to go to speakers first to talk to us about what we know on the ground, what's happening, and what people are seeing in their community. I'll ask the speakers to first tell us who you are, what work you do, and then what you're seeing on the ground in your community. And we'll start with Zoe Dodd.
Hi. I don't know if I have to like I don't know how to put myself here. I don't know if I'm in the big screen, so.
Oh, if people put themselves on speaker view, if you put speaker view in the top corner near the chat, if you put it in speaker view, then on everyone's computer, Zoe will show up as the number one person.
Number one, just kidding. Hi, my name is Zoe Dodd, and so I co-organize with the Toronto Overdose Prevention Society, and I'm also a frontline harm reduction worker. I coordinate a program for people living with hepatitis C, and I help out with the supervised injection services, and helped with a group of people to establish the Moss Park Overdose Prevention Site, which was an illegal injection site that we ran in a park in Toronto for almost a year, and I think many people are familiar with it. So I was asked to speak to a number of questions, so I'm going to try to do that. There's just like so much to talk about, and specifically about criminalized people who are on the streets, people living in shelters, people using drugs, and that is the familiarity that I have and what I know, so I'm only going to speak to that. So what we know on the ground is about 2 weeks ago, a lot of social programs that existed for people, drop-ins, meal programs, started to shut their doors. Even the program I work in, we had to stop seeing people. We didn't really give people enough time to do certain things. Like a lot of people were coming and saying, they didn't even know what coronavirus was, or COVID-19. They didn't understand what's happening around them. They didn't have money to do things like put groceries in their cabinets because they didn't have cabinets to put them in, and they didn't have money to like go and quickly get drugs, so they had enough drugs for the future. And also just to say, and I know there's other people on here watching as well who are also working in the overdose crisis. In February, it was the largest amount of overdose calls to paramedics that we had in years in Toronto. We had seen an increase in overdoses with fentanyl mixed with benzodiazepines. And so not only are we dealing with the crisis of homelessness and now COVID, but also the overdose crisis, which we've never been resourced to actually to address. We've never had coordination to address it properly. We had a task force in the province of Ontario, but when the government changed, they stopped that. And so many people on the front lines are dealing and support, and those also experiencing this are experiencing the overdose crisis, the housing crisis, and now COVID. And so we have like really vulnerable people who are incredibly risked of being having interactions with the police. They're already criminalized for using drugs. They're already criminalized for being homeless. And so what's happened with all these programs closing is that a lot of people are like out on the street. And then also with our supervised consumption services, we have 9 sites in Toronto. We had to change like our protocols because when we deal with overdoses, we could be aerosolizing the virus when we use oxygen, high flow oxygen. So some sites had to close their doors, like the Works in Toronto closed their doors for a week. Well, they had other reasons to close longer, but they had to close their doors because they had to put in new protocols. They're run by public health. And then we also had to substantially scale back, which meant that a lot more people were outside. And on one day, there were up to 15 overdoses in one neighborhood out on the street. So this puts people at risk of contact with police. It puts people at risk for their lives. So yeah, we're scared of COVID. We're also scared of people being criminalized more and people dying of overdose. So also to just say that the shelter system is like completely overcrowded in the city of Toronto. We have over almost 8,000 people that live or who are staying in a shelter network of 60 shelters. And the city has created quarantine and isolation sites for people who do test positive or who have symptoms. The system isn't working out so good as of yet. There's lots of kinks. And what's happened is that people will have symptoms within the shelter system. They're supposed to go and get assessed, and then they're supposed to go get isolated, but sometimes people are being bounced back to the shelters, which can't handle the isolation. People are also really afraid. I mean, we're talking about people who've been criminalized and institutionalized, Indigenous people, Black people, people who are really poor, people who use drugs. And so their experience of being institutionalized really needs to be recognized by those people who are kind of like orchestrating these like isolation centers and testing regimes. So right now, we have to get people from, like, so if we have someone sick at our workplace, we have to get them to an assessment center. And we still haven't dealt with the fact that, you know, people are afraid to mistrust the healthcare system. They're afraid if they go and have to be in isolation, they can't get drugs, so they'll be dope sick. And so there's a number of staff at shelters who've talked about how police have had to come and threaten to arrest people or arrest people to take them to the assessment centers. Also people, and of course people are really afraid. We also can't have 7,500 to 8,000 people in such close quarters. And so while the government is demanding for people to stay socially isolated and physically distanced and all of these things, that seems to not have to apply to the shelter system, which they are in charge of. And so what the concerns, like there's so many concerns, but if they start charging people, they've never really given people an opportunity to actually be able to physically distance or be in spaces of their own. And so we have a demand here in Toronto for them to open up hotels, and the city keeps spinning it. Oh, no, we're opening those. No, those are for the isolation and quarantine center. That is not for people to practice physical distancing and not get sick. Epidemiologists have predicted that 800 to 1,200 people will get infected in the homeless population. And we're talking about incredibly vulnerable people with lots of other health conditions. And so the police are using, so we're concerned about police also policing people on the street because they're more visible on the street, and then them being an easy target because they're out there trying to purchase drugs. And also, you know, we have places like our supervised consumption sites, which are de facto decriminalized spaces. I mean, that's where decriminalization is. We have doctors, some doctors prescribing safer opiates to people, which is a really good intervention, considering that we have a toxic drug supply. This is also like a form of legalization and decriminalization. So what we need is an end to the drug war, an end to prohibition, so that people are not then more targeted, being visible out in the streets while everybody else is isolating out inside. You know, it's going to get harder and harder if we get lockdowns. How are people going to acquire drugs from their drug service provider? And we've kind of, a bunch of us have been sort of talking about drug sellers being drug service providers, because lots of us use drugs, and these people have been providing a service to many of us through our lifetimes. So I think the other fear is that people are starting to feel really desperate. People haven't had money in their pockets and haven't been able to get money in the ways that they have historically, or they normally do. So you can't take back empties, you can't panhandling is really hard. Doing sex work on the street has become really difficult. Boosting, lots of people boost from corporations and stores and sell those items. They can't get money for that. They can't boost from the liquor store easily and sell that. So it's become harder and harder for people who are on the street to get money. And, you know, using a drug like fentanyl has become like kind of, it's expensive habit for a lot of people who use regularly. Sorry, my dog is in the background. Who use regularly because people's tolerance has built up quite fast. And so people need money. And so one of the things in which people could would help people who use opiates and stimulants is if we could have people who prescribe drugs, like doctors and nurse practitioners, start prescribing to people. Start prescribing to people so that people are not having to, so they can physically isolate and they have a reliable drug supply. So I'm just trying to think of what else. So for us, what also is uncertain is that the city doesn't have a proper plan when it comes to testing people within shelters and drop-ins. And so the fear is like that they'll look for ways of criminalizing people more and using more like security kind of culture to like force people to go and do things like isolate, like go to an assessment center, instead of sending teams of people who are, you know, super kind and want to like assist people and actually test them within these shelters, and not force people to go to assessments. And then, you know, people are then, if they do need to be quarantined or isolated, they're going to be on their own. So there is like a real fear for people once they leave their community, what's going to happen to them? Such a distrust, you know. And I work with a lot of Indigenous people who've been taken in the 60s scoop and from their families, and like who grew up in residential schools and grew up in care. I mean, like so many people I have support grew up in care and institutionalized. And so it is like a real fear for people to then be forced into isolation, and then what will happen to them. And like, I know there's doctors working with nurses to try to make sure people are comfortable, that they will get drugs and they will be supported. But there is like a real fear for people. And I like am concerned that the use of force will be used to like get people there, or people will get further criminalized. I mean, like they say they're not, like they're still arresting people. They put someone who was positive with COVID in the Toronto South Detention Center recently. You know, that prison's only supposed to have 900 people. It has, what, 1,500 people? A guard brought it in there, so as well. So, you know, yeah, so I would say there's a lot of concerns, a lot of things we need to do. We need to get people out of the shelter system. We need to continue to talk about addressing the overdose crisis, legalizing and decriminalizing drugs, and ending the war on drugs, like all of these things. And these are like an opportune time. You know, Airbnb is looking like it has 25,000 units they can't rent. But people are very exposed on the street, and the risk of overdose is like so high. There were 7 ODs at the Moss Park Overdose Prevention site yesterday. There are places that people used to use that were safer for them, like bathrooms and coffee shops and libraries. Other places they could hang out, those places don't exist anymore. People are using in stairwells. They can't use in public bathrooms and drop-ins where there might be a staff around. So while we might have COVID here and people might die of that, people are really most likely, a lot of people are going to die of overdose. And that is like, I think, a huge fear for many of us who support people, because these spaces are no longer accessible to them. And if we could get people into other places and prescribe drugs, we could do a lot to help folks and curb the spread of the overdose crisis and everything else. So I think that's all I have to say, really. I just think people cannot forget that when they make these demands, like physically isolate, we got to remember we're going to talk about prison, but we also need to talk and detention centers, but we do need to talk about this like shelter system that the city and the government have completely ignored for forever. They manufactured the crisis and seem to be very slow on wanting to get people out of there. And seem like there was a case that happened at one of the sites, the shelters, and the staff were just told, well, if you have symptoms, then, you know, go get tested. And that's like, again, putting like everybody at risk. Public health are not doing a good job. Like if you were in contact, you would be told, go home, self-isolate for 14 days. And that's not what's happening in the shelter system. They just expect everyone to get sick, and they just expect everyone who's in there to get sick and everyone who's supporting them to get sick. And that's just like a very fucked up way to do things. So yeah, okay, I'm done.
Thank you, Zoe. Please put your questions to Zoe in the chat, and we'll get to them at the end of doing kind of this scan of what's going on the ground. Next, I'll ask my sister Maureen to talk about her work with the Committee for Accessible AIDS Treatment. Hi, Maureen, nice to see your face.
Okay, hi everyone. Nice to see you all there. Cécile, I miss you. So my name is Maureen Owino. I'm the director for the Committee for Accessible AIDS Treatment. What the Committee for Accessible AIDS Treatment is a coalition organization that works towards improving healthcare for immigrants, refugees, and undocumented people living with HIV. And so in the basis of this, the communities that we work with, like racialized community who have so many other challenges, including just access to healthcare. And with COVID-19 and the policing of, you know, a pandemic, there's just so many other things that just come to mind. So one, for the people we work with, especially undocumented people that we work with, the communities that we work with who are racialized communities, who are immigrants, most of all, and I go back to what Zoe said, there's even physical distancing. piece is just a challenge. We work with communities that first are involved in underground economy. So a lot of people who are working under the table who don't necessarily have SIM card, but also a lot of people who are on welfare or disabilities. So they subsidize their income. We do know, we live in Toronto. So they subsidize their income through other sources of income or jobs. And they don't necessarily qualify for these government supports, including AI. And even though maybe they could, the question is, are they even aware of some of those things? A lot of these people don't have access to healthcare because of their precariousness or lack of CNAM. And I know as of last week, the Ontario government specifically said that hospitals should be open to everybody regardless of their immigration status. But as much as this has been said, and it goes back to what Zoe says, a lot of the communities work with don't have access to necessarily news channels and TVs and whatever forms of news this is being passed on to. And all the HIV service organizations, especially the ethno-specific ones, are now not open to they're not providing services, group supports, a lot of services. Most say they'll do phone services, which, yeah, is a whole other thing. And so it's really challenging. People are isolated, people have no social supports in the country. They are mostly alone. A lot of them are living in shared housing, rooming housing. I know a group of men who share one bedroom house, 7 of them, and I've been having conversation with them. How do they even physically distance each in this space? But then even just in the terms of police, these are communities that even just policing the pandemic, these communities are already so traumatized. These are people who've run from countries where there's so much police violence that being policed in terms of this has so much trauma, brings so much trauma for people, and nobody's talking about this. They're not necessarily are not open to even just going to, because the trauma of ongoingly fear of being deported, fear of getting into the system does not allow them to even go to access these supports that are supposedly put in place. But then the places, the agencies that were there that's supposed to process a lot of these supports are already not providing the services. So there's really a lot of challenges with how this is being put out there. Like I'm listening to Alex and, policing a pandemic. Yesterday, for example, in Kenya, which is my home country, the government put this GSC or General Service Police to go and beat people in the street because they were not physically distancing themselves. And these are the kind of situations that are happening across the world. But even looking at it there, we cannot assume that it's equal, that these whole policies that are being put in place for the pandemic is assuming that everybody's equal. There's no equity lens. There's no looking at people's social location and what are the other issues that go on. And I keep thinking, yesterday I was calling a lot of my peers that I work with and saying, how are you? And how many people are calling and they're scared and they're home and they have nobody to talk to. And I'm thinking about that. I'm thinking about the loneliness. And now we are creating this other level of loneliness because people don't have anyone to talk to. People will go to work because they're working in jobs where they don't have the options of not going to jobs. They're the people who do PSW. Half of my clients or the people I work with are in PSW work and they are doing home care and they are working in very precarious positions and that put them at the forefront of even risk to COVID-19. But they don't have the option of saying, I'll not go to work because they don't have that power. They don't have that privilege. The social location, their marginalization does not allow them to choose whether they go to work or not. So they are working. They are going to provide services to these people. They are putting themselves at risk every day, but they also risk being arrested. They risk being stopped by the police. Who is the police going to stop when they go on the street to, we are in an emergency, so police will stop people. But who will they stop? Maybe me and my son walking down the street because we are Black and we have dreadlocks. Chances of us being stopped for not keeping the physical distancing is high. And so it's scary. I'm scared. I'm scared for myself. I'm scared for the people I work with. I'm scared for my community. And I keep listening to these calls, and I'm talking to a friend who's a nurse, and she's like, I'm working in the hospital. I'm at the front line, but we are being given masks like we have to prove we need it to get a new one. And she's a Black woman. And she's saying, I have a friend who has COVID-19. They have nobody. I have to go to her house and give her and take her food. And it is scary. It is very, I don't even know what to say. Like, I'm here, I'm hoping we'll come up with some interventions. I'm hoping that we will be able to create some online support to support people at the end of this and have those conversations. I don't know. I'm scared. I'm scared. I'm privileged enough to be able to sit in my house and work from home. But I know the people I work with, the people I call my friends, the people I call my peers, the people I call my community do not have the privilege. They are waking up every day to go work in those factories. Wherever those essential services are, it's where the racialized, marginalized communities work. It's where the undocumented people, precariously insured people work. They're the ones working in nursing home. They're the ones providing care for people who are sick. They're the ones working in construction. They're the ones working in manufacturing industries. So who's at risk at this moment? I don't know, like, I'll leave it there.
Okay, thank you, Maureen. Thank you for that. I really appreciate it. Next, we'll go to Elle Jones in the East Coast. Really nice to see your face online, Elle. You're on, oh.
I'm not touching anything.
Oh, you should be good now. You should be good now. Sorry about that. Yeah, we can hear you.
All right. Good afternoon, everybody. I'm speaking to you from Jabuktuk. Halifax is on the East Coast in Mi'kmaq territory. I'm going to mostly cover two things: the situation in the prisons and jails, and then also the African Nova Scotian community. And I'll try and keep it short. But before I start just talking about the specifics, there's two quick concepts I want us to kind of understand about what's going on that I think are framing some of these responses. So the first thing is for us to understand that in colonialism, there has always been a link between hygiene and morality, and then this is how these things turn into criminalization. So we know through this that some people are labeled as dirty, those people are outside society. We've constantly seen, you know, the portrayal of the native as someone that's contaminating, right? And so we know through history, this is what has led to the criminalization of health conditions and the idea of hygiene that then turns into public hygiene. So we're seeing this both in narratives of like, if we just wash our hands enough, we'll keep ourselves safe, right? So those who get this disease are unclean, and also, of course, then who becomes vulnerable. So I think that's the first concept that's really important for us to think about, is how health becomes moralized and becomes an almost religious thing. And then the second thing that that leads into is this idea of public safety, right? So who is the public and who is kept safe, and what does it mean to keep people safe? So of course, this is the logic of deportation. That's the Minister of Public Safety that deports people in the name of the so-called public. It's the logic of policing, keeping the public safe. So we always see this thing called upon, and of course this is what's being called upon now with these state of emergencies for health, that this is about public safety. But public safety has always excluded Indigenous people, sex workers are included for public, trans people, queer people, Black people, people with disabilities. These are all people that are excluded. So those are just two really quick concepts that I think are important in informing what we're thinking about. So with that said, I want to really talk about what's going on in the jails, and particularly how public health narratives now are really being twisted in order to justify incarceration, and also the dangers of when we engage in this work and we don't use an abolitionist lens. So of course, everybody is very concerned about institutions, not just prisons and jails, but also forensic facilities, institutions, long care home facilities, all of those kind of institutions that we all know when a cold or flu circulates in those institutions, we've seen what happens. And we know that these are incredibly dangerous sites for infection. And of course, it's not actually so much the prisoners that will bring it in at this point, but the guards. It's the guards that are in and out on the street. So for people that are trapped in there and are powerless, they know that this same staff who on a regular basis isolates them, pepper sprays them, retaliates against them, denies them their rights, is now both going to infect them and then be responsible to their health, right? So how do you trust or believe in a response from people whose job it is to abuse you day after day, and who now are both going to infect you, lock you down, and then you have to rely on them? So I think that power dynamic is really important. So of course we were advocating for release. But what happens in advocating for release is, of course, so intermittent sentences were stopped. That's people coming to serve weekends, and they have stopped that, and I believe in most jurisdictions. So they've stopped that. And then we were talking about, people were talking about low risk people, non-violent people, this kind of language. And we did actually have a number of releases, but what we've seen is as a result, the language shift. So as we had some releases, that got very gendered. So it became about who's sort of worthy. Some people got put on one side of the line and some people got put on the other. And those who are essentially left behind, particularly in the provincial jails, have now not only experienced watching other people get released, but are now experiencing themselves as those that are marked for death and those that are unworthy. So other people can get out, but I can't get out because I have a violent charge that I'm awaiting that could be dropped. But right now, as I hold this charge, I am no longer considered part of even these people that are eligible for community. So that has really impacted the kind of levels of panic that we're now seeing in the jail, where they're seeing other people at the door and can't walk out themselves, and how that's psychologically impacting them. Then what has happened too is that, of course, as we're releasing people, there has to be housing, which there isn't. There's a huge gap in housing. There's a huge gap in things like people's methadone, right? There's a copay that is unaffordable for most people. There's a lot of forms you have to sign to get continuity with your prescriptions. So all these things are really difficult when people are getting released. So of course, we were advocating that obviously the government needs to fund these long-term supports. It's not safe to release people. So then they turned around and said that is a logic for not releasing people. So now under the name of health, they're saying, well, we can't release people because if they don't have methadone, if they don't have housing, it wouldn't be safe. And now they've actually written a letter. So corrections wrote a letter to the courts and said it's actually safer inside jail than in the community. Because we've been able to take all these measures inside the jail to keep things clean, and actually there's more spread in the community. So they are now using this, really twisting these logics of public health, so using social services that don't exist to now say it's better to keep people in jail. And very paternalistically, we had a lot of medical health staff falling into this. We're like, well, I don't really feel comfortable releasing people to the community without support. So I'm like, is that your decision? If somebody wants to get out, you have to consider what their health is. And now you're making a decision for them about what health looks like to them, what safety looks like to them, what freedom looks like to them, and basically paternalistically installing this very colonial narrative about, I know what's best for you, so I'm going to oppose your release. So we've seen these really, really dangerous ways that these public health narratives have been shifted around to continue to justify incarceration. And also, on the other hand, how these dangerous narratives of like low risk and nonviolent and pregnant or whatever are being used to create a huge divide between those who are inside who can get out and those who imagine themselves as marked for death. The other problem we've had with the public health response is that everybody who's responsible for it in the jails basically is playing both sides. So they work for corrections, right? Or they're going in on the advice for corrections. So we have things like our public health officials coming into the ranges to speak to people about their health, but with the supervisor standing right beside them. So how are you supposed to trust that that doctor can give you information that's serving you? In one case, what they heard from the public health official was they were told, if you don't report your symptoms early, we don't have ventilators for you. So that, of course, caused an immense amount of anxiety and terror in people. And they weren't even able to ask follow-up questions about what that meant, because the correctional supervisor was standing right beside them and interrupted them every time they tried to ask follow-up questions. And then they're publicly saying, oh, we gave them all this information because this public health official went and talked to them. So I don't know what they're talking about when they say they can't get their questions answered. So we're also seeing this real abuse, what I've always called as medical abuse, which I think is something that very much, I'm trying to talk fast, sorry, something that very much takes place in jail is that services is supposed to be for you, whether that's mental health services or counseling or these groups, all work for the jail. They work for the facility, right? So that, like, we strip search people in this jail when they go to get methadone every day. That is medication. But in order to get it, they strip search you so you don't spread contraband around the jail. So then how are you supposed to trust a doctor when that doctor is responsible for stripping you, or that nurse is responsible for stripping you and degrading you? And most people have histories of trauma and sexual assault. So then when you get out of jail, do you want to go see a doctor? Or is your experience of seeing a doctor around being sexually degraded? If you have counseling, but that person is reporting to your parole officer, are you going to voluntarily go see a therapist when you get out of jail or prison? Or are you scared of that? And have you experienced that as surveillance? So what does that mean now in a public health crisis where we've traumatized people in relation to their medical treatment? And now we're talking about, oh, but now we expect you to keep safe when you're in community, but you don't trust doctors and you don't trust nurses. And the nurses are the ones that accuse you of cheeking your drugs. And the nurses are the ones that threw you in isolation. And the nurses are the ones that reported on you. Like, these are medical professionals that have acted as police to them. And now they're expected to obey them. And if they don't, they are being actually breached and thrown back in, right? So we have all kinds of people that are now just being breached. So that's something I really wanted to talk about. The other division, I'm trying to be fast, that was mostly provincial. Federally, they know the provincial people are being released and are not being released themselves. So there's also this division where, again, other people are getting out. They can let those people out. Why can't we get out? I heard from one minimum security facility where they're being asked to wash, the job is to wash the sheets of other facilities, right? Like, that's what they do, is they wash the sheets, and they can't refuse to work, because if they refuse work, then they get sent back to the medium security, and that delays their release. So they're basically being forced to touch sheets that could be contaminated. Otherwise, they risk their own release. So we're seeing these kind of situations. I wanted to switch. I know we have a lot of people on call. So that's jails and prisons in short. If people have questions, I can answer a bit more. The other thing I wanted to say is the context of policing in the Black community. So we have been dealing with street checks. This is carding in Toronto, racial profiling, stop and frisk. All these things are the same thing. In Halifax, it was shown that Black people, African Nova Scotians, are 6 times more likely to be street checked than everybody else. And 1/3 of Black men in Halifax are carrying a criminal charge. For people who don't know anything about the history, the African Nova Scotian history community is some of the oldest Black communities in North America. There's the first Black person in North America came to Nova Scotia. So we're talking about settlements that are hundreds of years old of people. Many people also share Indigenous and Black heritage, just so people understand the community. But we've been fighting, so we got a report this time last year showing that street checks were a reality, which Black people have been saying for generations. And there's supposed to be a ban upon this, that they can't ask us for our information, they can no longer do these checks. But of course, with the state of emergency, the Public Health Act now says that if you are stopped for health reasons, you have to give them your address, you have to give them your name, you have to give them your personal information, your health information, your employment. These things are now being allowed. And technically that's supposed to be under a justified medical check, like they think you're breaking quarantine. But we know in practice that that's not. And we know that if you're walking on the street, just taking a walk, and a cop comes to you and says, well, under the Public Health Act, I want to talk to you. Like, what are you going to say? Oh, no, my reading of the act says this. Like, you're not going to say that. They already don't accept that. And if they do violence to you, beat you down, charge you, who in the public is going to be sympathetic when the public has set up this narrative that cops are the heroes of this pandemic? They're helping us. They're keeping us safe. You know, we need the cops to make sure that people obey the rules. You know, so when we have this public shift to glorifying policing, glorifying social surveillance as well, right? So everybody installing their own imaginary idea of what's safe and then imposing it on others, right? So even though we're being told publicly we can go for walks, and you get people complaining that people are taking walks. So, you know, who is going to be a victim of that? A Black man with a hoodie and a mask on, right? Like, or the white person walking their dog. We know this is class, we know it's race. So we're also seeing this as reinstalling a system of street checks that were never truly stopped. We never believed the cops had stopped street checks. We knew they were continuing them. But now, of course, they have the power to basically increase their police presence, no accountability. We can't meet to protest. There's no police board meetings. So this is going to have a huge effect on the Black community. And the last thing I'll just say really quickly is, of course, the borders and the role of, you know, policing the borders and people's idea of contamination. This goes back to the first thing I said. So everybody's called to shut down the borders, and thank God Trudeau finally shut down the borders, but like not to white snowbirds who, you know, are coming home. They can come home, just not to migrants. So who's being imagined, of course, as being the vectors of disease isn't white people coming in from Florida, rich people, people who can travel. It's migrants and refugees. And in my province in particular, we have a huge agricultural industry sustained by so-called temporary migrant labor, right? So that's going to have a huge impact as well, both in the poverty that is then caused in places like Jamaica, where we get a lot of our labor from, that now those people are blocked from coming in, that have come in season after season after season, and yet have no right to any of these compensations coming from the government, no right to any job continuity, have basically, so now we're just screwing them. And then of course, migrants can't come in as well. So I know we're short for time, so I will stop there. I kept promising to stop. I'll stop there, and if people have questions, we can also follow that up.
Thank you so much. That was fire and very powerful and important. I think there was There is time. So like, if you have more to say, please say it. I don't want people to feel rushed. So if there is more that you want to say, feel free to jump in at the end as well too. We have this call for 2 hours, but I put it for 3 hours so that we don't get cut off. So if people want to talk more, I don't want people to feel rushed. This is an important, complicated conversation. So I think we should have it. So the next person on the list of people telling us what's happening on the ground now is Mikiki. In Toronto with Queers Crash the Beat.
Is it unmuted? No. Unmuted now. Great. Okay, I'm going to take it off the speaker thing so that I can not have any interruptions. Hi, everybody. Thanks for inviting me. Alex, thanks everybody for showing up. Thanks to the incredible speakers. Also, Elle, that just blew my mind apart. So thanks. That was super, super fire. I first just want to say that I think that like this timing is really shitty because a lot of us in community are working on issues that hold like grave importance to our community members. One of the issues that I am seeing I'm scared about is the idea of the coastal gas link and Wet'suwet'en territory. So I think that just as a reminder that there's a potential link with bringing COVID-19 to this like unceded territory, and I just think that that's also a thing that we should kind of have in our hands and be speaking to those that are supposed to be representing us. Okay, so a little bit about who I am. I have been working in the HIV response and been a sexual health educator for over 20 years in various capacities, in public schools, working in HIV organizations, doing prevention, treatment support work, as well as within the last 10 years working within the harm reduction sector and coordinating street outreach for folks that are homeless and use drugs, as well as working with gay men living with HIV and doing sexual and reproductive health promotion and specifically harm reduction work for gay men who use drugs. Also, I have been doing policy and board work for HIV and Hep C co-infection work for a number of years. And also now I have quit social service because I'm too traumatized and my therapist won't let me do that work anymore. So I am now a full-time cultural producer who's making work about my experience as a person living with HIV for over a decade, as a person who uses drugs, and as an anarchist. So I'm here speaking on behalf of Queers Crash the Beat, and we are a group, like a loose ad hoc group of folks that got together in 2016 in response to the Toronto Police Service Project Marie, which was a project of entrapment of gay men who were having sex in a specific public park or cruising for sex in a public park. And after the park hours had officially closed, we also know that this project went on for many years, and they spent over $100,000 to potentially hundreds of thousands of dollars on this pet project of one officer in the Toronto Police Service, while they ignored community calls to investigate the multiple murders of mostly brown, South Asian and Middle Eastern gay men in Toronto's gay village. We also know that the murders were only initially investigated, or only like seriously investigated, after a white community member who was also a friend of mine was murdered. So I'm here to talk about gay men and hooking up, and those of us in our community who are who are still connecting with people sexually and who are partying and using drugs. Party and play, or chemsex, is the kind of the phrasing that's used around this. I think it's important to acknowledge that for a lot of gay, bi, queer, and other men who have sex with men, and I'll just use the term queer men kind of as an umbrella term to refer to all gay, bi, queer, and other men who have sex with men. So there's a lot of evidence that actually talks about the lived reality of loneliness and isolation that specifically queer men are experiencing. I know that we also see within the LGBTQ2I spectrum, we're seeing a lot of social isolation and disconnection from communities, but I'm speaking specifically to queer men's experience. So we have a lot of evidence of isolation and loneliness, and we also have a long history as queer people of using whatever tools are available to kind of mitigate our internalized homophobia, the sex negativity that's forced on us, and also our own trauma histories. And I would also include within that the being raised as straight people and then failing as straight people, and doing that for a lot of us within the context of the other pandemic of the HIV epidemic. And for a lot of us, how we mitigate those kind of other factors in our lives is through using drugs or taking mind or mood altering substances. We know that all of humanity takes mind or mood altering substances and always has, and queer people are no different. We also see that that's a way for us to kind of get rid of or mitigate our social anxiety and to lubricate conversations around accessing sex and intimacy. So why not then just stay home if this is like such a dire situation as we know it to be? And I think that there's a bunch of reasons in my head as to why queer people and queer men are still connecting and will still connect for intimacy, for pleasure, for community, for connection, and do drugs while we're doing it. I think it's, for a lot of us, we have this knowledge, whether it be like a tangible, practical, experiential knowledge of state interference in our lives around seeking pleasure and around our ability to like access community or just even identify publicly. I think that while some people are using this opportunity of self-isolation as a time to like reflect and maybe step away from our patterns of use or the ways that we use drugs in relation to our sexuality, for others it actually is kind of heightening that need for connection. And one of the things that I think we are kind of falling prey to within like larger conversations about queer men's experiences or queer men's actions, and therefore our character within this new pandemic, is this idea that the seeking of pleasure and intimacy and connection, which queer men are known for and will continue to be known for, that action and that drive is inherently irresponsible at best and malicious at worst. And I feel like we can extrapolate, because we have seen this extrapolated before, that it is also seen as suicidal all the way to murderous. And I feel like that idea of what queer men are kind of like oriented in terms of our relation to pleasure, I think is really important for us to kind of have some awareness of, pick apart, etc. And I think it's also like important to note that intimacy and pleasure are like basic features of the human experience. I hope that that's not news for anybody. And I think that we are going to find ways of connecting. And for some people, having lots of cam sex is a really awesome opportunity for people right now to like explore that idea of like being as debased and degraded in front of other people and like reveling in all of the sexiness of the things that you were told you're not supposed to do, but you love. That can be a really, really meaningful way for people to do that. I'm not a cam girl, so I'm not going to be like having my needs met in that way. So I think it's, while there's like information coming from, we saw New York Public Health put out this pamphlet, and I'm going to post these resources in the dialogue box after I stop talking, because I can't do more than one thing at a time. But we saw New York Public Health put out a kind of resource that's a lot of words to basically say sex positivity right now means don't have sex. And it's in some ways a harm reduction framework, I would say. And the thing that I found the most frustrating is that it's basically saying like, don't rim and don't kiss. And that's like, oh, I'm feeling personally attacked. There's also a COVID-19 resource around sex and sexuality for people who use drugs. I will also forward that into the larger group chat. And I think that is the languaging and the mood board of that is a little bit more acknowledging that people have needs and they're gonna meet them because people have been finding ways to meet our needs that exist outside of state services, outside of capitalism, or like the capitalist machine for numbers of years. The issue, I think, is about how do we hold these two ideas that can seem contraindicated or too disparate, but it's this idea of how do we support personal bodily autonomy, and how do we also hold ourselves and each other accountable to a collective idea of care and prevention. And I think that these are the questions that I am so glad that Sandra is coming after me, because I saw their post on something that Alex posted on Facebook, and it was like, just don't fucking call the police. You know, like, mind your business, stay in your lane. Like, the thing that comes from this idea of queer men's pleasure seeking, which also is just intimacy seeking, or also just community building. So the idea that our need for connection and intimacy, and that we might, like, take things to enhance that or allow ourselves to access that, but that is inherently like a moral failing, I think is like one of the things that we need to kind of pull out of this question. I'm hoping that this will maybe be a way that we can kind of address this in a larger way. Just quickly, a couple of last points. I want to refer to the Barcelona 8, solidarity with the Barcelona 8. So they were the folks that, if you haven't read, there were 8 men that were charged on drug offenses in Barcelona for having what the news media has called a drug-fueled orgy. And Stephen Muldrum is a public health researcher who tweeted about, like, we don't see straight people's cocktail parties that are rife with crudité. Such a beautiful quote I couldn't avoid. But, you know, like, there's this, I think, is a good indication of one of the things that Queers Crash the Beat talked about and learned of, is that police find ways to punish people that they believe deserve punishment, and that can sometimes be through like finding ways to apply bylaws or finding criminal code legislation, whatever, to fit the purpose of punishing who they believe needs to be punished. So we see that with carding in Black communities. And we see that, we just see that in multiple different ways. We see that with the application of trespassing in a public park. It's like, oh, cover your eyes. The children are going to see us having sex in a park at midnight. I'm sorry, but if your son is in the park at midnight, it's because he has a different goal than going on the seesaw. And we see the police are going for the lowest hanging fruit, and that I'm using that really terrible pun intentionally, in that the police historically go for those of us who are the most marginalized, because they know that there is less likelihood for us to be able to respond and to resist. So we know that in Canada, that is Black and Indigenous people primarily. We see that as people who use drugs, people who are living with HIV, people with disabilities, people who do sex work, et cetera, et cetera. These are all my friends, and these are all people that I'm having sex with, and also people that I'm getting high and having sex with. So how do we look out for each other? And I think this is the question that I want to kind of end with. I think, by and large, we don't call the cops on each other. We ask people if they have support, and if they have people that can support them. One of the things that I think our response to the Barcelona 8 of this, the horror of people having a sex party during the time of lockdown, is that there's this assumption that none of them had a conversation either with themselves or with the other party goers or the hosts about managing their health, about harm reduction, that they didn't think about it. They were so guided by pleasure that they were unable to think about mitigating any likelihood of negative consequences. And I think that that is how we see queer men's experiences, and I think that that's also one of the things that we need to challenge the most strongly. So to say, don't call the cops is great, but I think that one of the things that I will call for queer men to do moving forward is also to kind of like, round each other up in like gentle and generous ways, because recognizing that when I'm at a chems-fueled sex party, there are people there who may share my like abolitionist, anarchist, like moral orientation, but there are also people there who believe firmly in the rule of law and just hold themselves outside of that. Like, I'm doing something that's illegal or extra legal, and but otherwise I'm a law-abiding XYZ good person. So how do we hold space and share space with people who have different like ethical orientations than us? And I think that fucking them is a really great way to like build solidarity. The last thing I'll say is that the Gay Men's Sexual Health Alliance of Ontario, or GMSH, is going to be doing an informal, the kind of like online hangout chat room kind of video conference that's going to happen this Wednesday evening. We're intentionally having it in the evening because we don't want it to be overrun with people who are not queer identified, male identified people who use drugs. So we want the comments to be not any pearl clutching. We want it to be people who are a part of the community and a part of the scene, asking questions that are relevant to their experience. So if you're interested in finding out more about that, because that's who you're working with and you want to give that link to them, or if it's your experience, then please hit me up and slide into my DMs. Thanks.
Thank you so much, Mikiki. That was wonderful. So again, anyone who has questions, toss them into the chat box, and we will get at them at the end. I'm going to switch over, or pass it over to Sandra Wesley from Stella. Good to see you, Sandra.
Hello, everyone. All right, there's a lot to say, but I'll try to be efficient here. So I'm from Stella in Montreal. We're an organization by and for sex workers. We do frontline services. We do up to 8,000 contacts with sex workers in the community in Montreal every year. We also do advocacy for sex workers' rights. And one of the interesting things about Montreal, which is maybe a bit different than some other cities in the rest of Canada, is that we're very, very connected. Community organizations in Montreal talk to each other all the time. We have all kinds of networks where we're talking to each other all the time. So it allows us to be really looped in as to what's going on in different communities in Montreal right now. So a few points here in Montreal that are happening. So obviously the daily life for a lot of people on the street has been completely changed. There's no public, well, there's a few public washrooms that they installed that are cleaned once a day and that are really disgusting. But the normal places, the McDonald's, the Tim Hortons, all other public washrooms are shut down. Most indoor spaces where people can go hang out are also shut down. And so, as others have said, people can't make money in the same way that they normally do. We also have some resources that have stayed open, but a lot that have shut down, including a few days ago, our supervised injection sites had to mostly shut down, not because of their own decision, but because public health determined that they didn't have the right equipment to be able to resuscitate people and reduce the risk of spread of coronavirus. So they're essentially saying, okay, so then you can't even have the site open. So people, if they were going to die, they can die outside instead of inside. And you can't even reanimate someone who's dying because of this hypothetical fear of a virus being involved in the interaction. So we're seeing that it's very hard to have any rational conversation about these things. People are worried about, people from public health, people from the health network are worried about liability, or worried about all kinds of issues that aren't people's survival in the moment. So obviously there's a lot of work done to try to address that. We've also finally a few days ago had an order from public health for pharmacists to give people more than 1 day's worth of methadone or other treatments, because we still have a situation where people who receive those medication need to go in every day to the pharmacy to take it in front of the pharmacist. So we were forcing people to just go out every day just to go to the pharmacy, which is absurd in the current context. So that's been slowly changing, but we've been having a really hard time getting things to change. In terms of sex workers more specifically, so obviously there's a really, really big diversity of people doing sex work and of ways we do sex work and of living situations, social situations. So there's no one way that sex workers are affected by this, but everyone is affected in some ways. So obviously it's very easy to think about how people either living on the street or working on the street are affected. You know, it's just not possible in the same way. Obviously, there are very few clients. When we're outside, we're very visible, so therefore targets for being harassed by neighbors or passerbys and police as well. And then it's a matter of immediate survival. But we also have most of the massage parlors and escort agencies that have shut down. Strip clubs have been shut down as well. So we have sex workers who normally have a good income and are normally not necessarily feeling like they're living in poverty, that are still being affected, because as sex workers being criminalized, we can't access basic things such as bank accounts that can be really difficult to access. We can't necessarily save money because our money remains proceeds of crimes. It can be seized. You know, we have an entity in Canada called FinTrack, which is supposed to surveil banking transactions to look for money laundering, but now they have anti-human trafficking guidance that they're giving to banks to report sex workers and to seize our money, to freeze our money, to investigate us in different ways. So a lot of us don't have access to those basic things that our level of income should give us. So such as just getting an apartment with a landlord and an actual lease. That's not always possible. So we might be renting from a friend or from like a sketchy situation. And that puts us at risk of eviction and of other types of problems very quickly when we run out of cash to be able to pay our bills with. We also work a lot with cash, which is now becoming the vector of disease that no one wants to handle anymore. So people might have cash, but you can't pay your bills online with cash. You can't do it if you don't have a bank account to put it in, or it's dangerous to put it in a bank account, then you can be stuck even if you're not in extreme poverty. But obviously, despite the myth, I would say that there's a majority of sex workers that are either living in poverty or living very close to poverty and very at risk. So most of the women in our community are struggling a lot financially right now, and with the fear of how long is this going to continue, and what decisions do they have to make to try to get through it. So if people are renting an apartment to do in-calls and they can't work in it right now, well, do they get rid of the apartment or do they keep it and try to take the expense? Those are questions that people have to grapple with right now. So we've heard about police going to massage parlors and strip clubs to inform people of the closures and let them know, a friendly reminder that they're not allowed to be open right now. We've also seen police officers patrolling outside in little groups, and that's an interesting thing that a lot of people have noted, that they're not social distancing with each other. Cops are walking next to each other in little groups and little clusters, as they always do, which is really bizarre to see that in action. So we've seen them patrolling a lot. We haven't heard a lot of specific incidents of people being arrested or people being harassed in a different way than they normally are, but there's this sense of a different attitude from police and a new type of police presence. And I think that's a very important point when it comes to talking about policing, is that the fear of repression is repression. It is the harm, and you don't have to ever get arrested or ever even encounter a real cop in your everyday life to feel the impacts of being criminalized. And that's what we're seeing, that when the risk is, you know, spending 5 or 10 years in prison, then you have to act as if you're going to get arrested any moment. And people cope with that in different ways. There's obviously a lot of ways that we just ignore it sometimes. We just pretend it doesn't exist. We tell ourselves a lot of stories as to why the way we're committing our crimes makes us immune to being arrested, or but we also have to change the way we work in order to protect ourselves from the risk of being policed. So we see that sex workers are scrambling to find ways to do this, and this is a question that we're getting a lot from sex workers. They want to know, what can they do to protect themselves? And there's no answer, because police are predictable in the fact that they will always target the more marginalized people, and if they decide that they want to target someone, they will, no matter what. But they're also unpredictable in the sense that we don't know what they'll do right now. There's a sense that they're very giddy, they're excited, they have all these new powers, and they're going to be testing things out, they're going to be trying to see what they can get away with. We were already, before this started, having conversations in our community about the facial recognition app that cops have been using and what this means. So there's a lot of big concerns that we don't have necessarily answers for in terms of how this will actually roll out in our communities. So another thing that I wanted to mention is the way the conversations around not just police, but around repression and social control have been shifting a lot and very quickly. So even people within our own communities have very easily gotten caught up in the panic over coronavirus and the need to denounce people, the need to judge people. And there's a fine line between saying call the police on people and going on Facebook and writing a whole rant about how you're seeing a lot of people in your community that are not following the rules. And for me, one of the big messages that has been circulating a lot that I find very worrisome is people saying, in order to avoid further social control and more restrictive measures, people need to follow these rules. Or if people were just obeying more, we would prevent more restrictions from happening. And I firmly believe that there's absolutely no cause-effect relationship between how people are responding to the current rules and what next rules we're going to get. I think that if the government decides to push this further, if police decide to be more proactive, their question is not going to be objective information about whether or not people are respecting the rules. It's going to be, do they feel that the public perceives that people are not following the rules? So I think it's very important that we find a way to not buy into that discourse. And for me, what this means is, one of the things is that we need to actually position ourselves in solidarity with people who are breaking the rules and people who are being irresponsible. And that can look like different things. Obviously, a lot of us in our communities are at risk of really massive health complications if we do get that virus. So I'm not saying people need to be okay with people infecting others, but we need to have a very strong position that doesn't demonize people, that doesn't pretend that any one person is going to be the vector of disease that's going to kill everyone. And that's very hard to do with the current language that we're seeing. So for me, there's a few other points that relate to that. One of it is that while it's really, really important to obviously talk about abolition and to maintain that as the goal and to make sure that our actions are coherent with that goal, a thing that happens sometimes, I think, when we're having those conversations is that some people have a very or a more ideological position where they'll be like, don't engage with police at all. Don't try to minimize, don't engage with the system in any way if you actually have a abolition stance. And we need to really not do that right now. So if organizations or individuals need to interact with police in a certain way to protect themselves right now, then they need to do that. If organizations, if at Stella, we need to be calling police officers and police chiefs to try to negotiate with them some reprieve for our communities, then we can't not do it, or we can't just say that we're for the abolition and therefore we don't engage with that. And the same, I think, applies for our notions of community care, or of being in community or being in solidarity with each other. we can't be ideological about it, because I've been seeing a lot of people, you know, having these really great ideas of how, as marginalized communities, we need to come together, we need to help each other. If people can't make their rent, well, someone should be helping them. We need to go on strike. We need to bake for each other. And that's really great, but there's a line where this can cross into being judgmental of people who are marginalized but not partaking in any community. A lot of people who are marginalized, we can be very isolated, and we don't want to be in community. When I was younger and on the street, the notion of organizing collectively was the last thing on my mind, and I didn't care about that. And anyone who would try to tell me that we need to care for each other as a community, I would tell them to go fuck themselves. And we need to keep that in mind and not think that there's something magical about caring for each other as a community. Finally, I would like to talk a bit about policing more specifically. What I'm seeing, that like for years now, I've been having conversations about public health and with public health workers. And I've been getting a lot of resistance whenever I bring up the enormous powers of public health and how dangerous they are, and how they have even more powers than police in certain ways. And a lot of people are very resistant to that. A lot of people working in public health see themselves as allies. They're in public health because they want to help. There's probably people on the call right now that work in public health and that obviously don't see themselves as agents of social control. But we need to get acquainted with the actual powers of public health and how they relate to policing, and what public health can do right now to reduce this. If every public health director who's on the news every day was also talking about all the other messages that they normally tell us in private, if they were expressing that publicly and they were positioning themselves against punishment and policing as a tool of public health, things might start looking different. But I'm not seeing that being done on any large scale, other than maybe a few comments on the side here and there. So we need to hold those people accountable, those people who fund us, who pretend to, well, who are our allies and sometimes pretend to be our allies, and who tell us privately that they care about us. What they need to, right now is the time to step up and do it publicly as well. So I think that we need to all be talking to these people in our community that have that power in some way. Also, this notion of $1,000 fine, and maybe I'm wrong, but from what I understand, like I've only in the past few years only heard of that being used either as a threat or when people have been personally named in a public health order, like for tuberculosis, for example. If someone is deliberately out there infecting people, then they might be susceptible to a fine. This blanket sense that we can issue a public health order and every individual who isn't actually sick and it isn't actually infecting anyone might be a target of this and might be detained based on this. Or even that people who are sick but not specifically named in an investigation by public health can be targets, and that this can become a blanket order for police to harass everyone. I'm not aware of this being used recently anywhere in Canada. So I think we need to find a way to have people who have the legal knowledge to be able to develop an analysis of this and look into the history of how these things have been applied. We need that information. And I know it seems like a bit like not the priority when we're in the middle of saving lives and just trying to survive. But those who have that knowledge, I think they need to get on that. And I think we also need to find ways that we can collectively, maybe on a community level, maybe on a broader level, find ways to monitor what the police is doing in a more centralized way. There's many ways this can be done, but I think we need to think about it. We need to produce tools for the public, like such as those lists of what to do instead of calling the police. I think we need to find those things and publish them and share them, and hopefully get public health to share them as well. But we need also tools for our own communities, which might not be written tools, which might just be messaging that we give frontline workers, and other strategies that we develop, or things that we're not doing publicly. And we need to find times to communicate with the government right now and make some clear demands that are easily put in place. We have bigger demands, bigger systemic demands that we have, but we need also to find very precise demands that we can make. And another thing that I'm not hearing at all about is what are the criteria that public health and the government has in mind to start easing the restrictions on people? Do we have an end game here? Do we have an exit plan? And I'm not hearing about it. And I think that that's something that we need to start thinking about. What will it take? What data will we need? What change in the epidemic will we need to start, you know, freeing people a bit more? I think that's a very, very important thing that we need to do. So I think that covers most things. I would add to that that I've been getting a lot of calls from media, and I've seen a lot of articles also, so I know I'm not the only one getting these calls, about how sex workers are doing right now in the epidemic. And I've noticed that there is a really, really big interest in either sad stories of how horrible our lives are right now, but also a really, really big interest in framing us as vectors of disease, as shaming sex workers who are still working. And even this week, I spoke with one who wanted to know what message we should send to clients to make sure that they're not seeing sex workers right now. So we need to be wary of media and ask ourselves, is it useful or not to do media right now? Sometimes the reflex when the journalist calls is to just pick up the phone and talk to them. But in this current context, I think we need to be a lot more strategic about what media we're doing, what message we're sending, and what requests we're just refusing to respond to. Because there's an accumulation of these horror stories that can lead to things getting really messed up. An example is how we've been talking in the media about homeless people and the lack of possibility to self-isolate when you're living in a shelter or living on the street. And we're seeing in Montreal, they responded this week by announcing that they would open a few different spots in one hotel and one hospital that was converted into a shelter for homeless people who show symptoms or who are waiting for test results. And it became clear very quickly. So they did that as a response mostly to pressure in the media, which gets twisted not into we care about homeless people, but we care about homeless people not being vectors of disease. And now it sounds like what they're actually going to do is detain people. It's not like, oh, we're giving you a hotel room so you can self-isolate. It's we're locking you up in a hotel room and we're guarding you and making sure you can't come out. And obviously that's a really thin line. And I think that the way we interact with the media can have a big effect on how those programs roll out. So we need to think, what do we talk privately with public health officials? What do we talk to the media about? And yeah, so yeah, that's about it for now, I think.
Thank you so much, Sandra. As always, you're so wise. Very much appreciated that. We're gonna rejig the agenda quickly, and I think for people who've just joined, just so you know, we're just doing the speakers. We're not doing the small group discussions that we planned, and we can go a little bit later to have a discussion. I'm gonna ask next, just to rejig the agenda, I'm gonna ask Syrus Marcus Ware from Black Lives Matter Toronto to speak about keeping abolition in view, resistance to police, and also what's happening on the ground.
Hi, everyone. I'm Syrus. I'm speaking to you from Toronto, from the little strip in the south part of the city that's unceded. And yeah, I mean, thank you so much to everyone who's spoken today. It's just so much to think about. I mean, one of the things that I think we need to be doing right now, absolutely, is figuring out how to live abolitionist strategies every day. This is my daughter, the youngest abolitionist. But how to start to live abolitionist strategies every day. And the reason why we need to start living abolitionist strategies every day is because we're seeing this phenomenon where we're being asked to be the police, the jailers, the surveillors of our communities. So not only is there an increased, as everybody has just described, you know, increased police surveillance, increased use of policing on the streets to track particularly marginalized communities, we are now being asked to do that ourselves. So they're setting up snitch lines. They're doing all of these things to try to make us into the judge and jailers of our communities. So of course, when that starts to happen, we know that Black people who are always already suspect are going to be flagged. We know that trans women are going to be flagged for just being in the streets, and for mad people who are seen as always behaving in unexpected ways in public space, we will be targeted by the police and be called by our community members. So we need to be living everyday abolition right now, because we do not need to become the PIC. We're being asked to be private investigators, to be undercover detectives, to be cops on the street, and to police our communities in ways for the state. And this is something that we absolutely have to turn around and say, no fucking way. We're not doing that. We're not participating in that process. Right now, we're seeing huge shifts and huge changes in our society, from things like mass decarceration strategies that we're seeing sort of globally, and other abolitionist strategies being implemented relatively quickly amidst the fears around COVID-19. And I think for a lot of us who have been doing abolitionist work for a long time, I've been an abolitionist for 25 years. You know, I don't think we ever thought we would see the day where every day we wake up in the news and another prison is letting people out, you know, as if it was just as simple as we always said it was, just fucking open the doors and you can let people out, right? So it actually apparently is that simple, and we can do that. Not to say that there isn't a need for post-release planning and community supports and all the things that come when people get out, but you could literally just open the doors and let people out. You know, I'm very inspired by the work of Vivian Salahena and the work of Giselle Diaz, and what they've sort of articulated and theorized around the myth of the dangerous few. So this myth of who is in prison and who goes to prison and why. And if we sort of topple that myth, we start to understand that it's actually our communities, it's our people, it's our brothers, our sisters, our lovers, our mothers, our grandmothers who are going to prison at disproportionate rates. And it's only going to increase as they start to target marginalized communities simply for the fact of being poor, of being on the street, of being Black, of being disabled, of being trans in the middle of a pandemic. So, you know, we have so much work to potentially do at this moment because we're seeing rapid change. There's this change in systems thinking. There's this change cycle model that's called the panarchy cycle, and it sort of follows what happens in the life cycle of a forest as an ecosystem. And it sort of says that you can kind of move through this period of rapid growth and expansion of the forest, and then it, you know, it develops elaborate networks, and it develops systems and plants and trees and everything interacting, and then there becomes, you know, a bit of a period of collapse, and then rebirth and regrowth of new ideas. And so this is a system cycle. We're seeing the collapse of a current system. This is what we're witnessing right now. This is why it feels so strange. This is why we wake up and we don't quite know what to do, because we are literally watching capitalism die in front of us, thank fucking God. So we're seeing it heave its last breaths, and sort of try to, you know, they're doing everything they can to prop up a dying system, putting $1 trillion a day into the banks, you know, trying to boost up all of these extractive economies, just in a desperate attempt to keep the billionaires rich and to keep capitalism going. But capitalism is dying faster than they can save it, right? So we are witnessing the end of an era and the beginning of something new. And this is where our work begins in earnest. As abolitionists, as activists, as organizers, we have been doing this work of prefiguring the kinds of communities that we wanted to live in the future. We've imagined, we've dreamed, we've spent time together talking about what kinds of communities would look like if we had self-determination of all people, if we had safe supply of drugs for all people, if everybody had what they needed to be able to survive and thrive, what would that look like? Now's the time to start to try to implement some of those practices. And this is where living abolitionists every day helps us to frame what are some of the things that we need to be doing right now in order to bring about the revolutionary change that we'd like to see. So I'm very interested in figuring out how we use this moment to rebel with everything that we have, because Assata Shakur told us we can win. We will win our liberation. And she said that we had to fight as if we would win, because then if we fall just short of that, we'll at least be so much further ahead than if we just tried for some sort of shitty reform. So I think at this point we have to imagine, if capitalism is dying, what are the levers that we need to pull in the system? What are the bricks we need to pull out from the Jenga tower to make sure that it collapses once and for all? And so, you know, addressing things like, the way that late capital is sort of playing out in our lives, you know, making sure that we don't participate in all of these industrial complexes that are designed to oppress our people. You know, thinking about how the medical industrial complex is an industrial complex that is, you know, dramatically affecting the lives of sick and disabled people, and has been since time. And now we're witnessing the failings of it. All the things that disabled people have been saying for decades about there being an inequality and an inaccess, all of these things are proving true now to a group of people who have been relatively healthy and are now recognizing that there's flaws in the system. So, you know, I'm very interested in how we get everybody to start talking about abolition. And I want to give a shout out to Chanel Gallant and to the Everyday Abolition blog, because it's a great resource. And, you know, there's interviews with folks about how you can just start to live abolition in everyday life. I was one of the people who helped to start PJAC, the Prison Justice Action Committee, which was a prison abolition group that ran in the early 2000s. We started a Prison Justice Film Festival, a campaign against the building of a youth super jail. And I can remember when we were doing that organizing, whenever we would gather people in a group and we would start to talk about how prisons were bad, or about how policing was affecting our community, or about all of these things that were sort of happening in our world, we would get to a certain point, and then when we started to talk about abolition, people would be like, whoa, I don't know about that. I mean, and I am so excited that we are finally in a moment where when we bring up abolition, people are like, yeah, all right, fuck yeah, let's figure out how to do that. And I wish it didn't come only because perhaps people are recognizing that they too can die. You know, so we're seeing a moment of abolition, a desire for abolition, when we recognize that prisons are going to dramatically affect the lives of us living in the community, right? So I wish that abolition was coming from a more altruistic place, but I'll take it. Whatever your reasons for getting on board right now, we need every warm body to be working to try to figure out how to decarcerate, how to abolish the prison industrial complex. And in fact, you know, one of the things that Giselle Diaz talks about a lot is this idea that abolition is rooted in Indigenous resurgence and is rooted in anti-colonial work. And so that abolition is not just closing carceral spaces, including psychiatric detention and immigration detention. Abolition is overthrowing capitalism on Turtle Island. And so this is where our work is beginning in earnest. We have an unprecedented situation where we have a lot of time, where we're inside, if we can be inside, and we have these moments where we're coming together and connecting in new ways across distance and difference, as Audre Lorde encouraged us to do. And now's the time when we can start to dream. Now's the time when we can start to imagine and start to plan and start to think, okay, you know how people are saying we don't want to go back to the way things were? Well, what's the fucking roadmap that we're going to instead? What's the plan? Where are we trying to get to in order to make sure that we evolve from this in a much better situation where everybody has what they need to survive, where everybody is able to thrive, where we are not thinking about things like money and debt and all of the horrors of raced capital. So, you know, the police are going to try to use this moment to try to get us on board with police-based thinking and prison-based thinking. They're going to try to convince us that we need to police our neighbors rather than bringing them fucking soup and caring for them and doing mutual aid and community care. They're going to say we need to be fearful of our neighbors. We need to be fearful of drug users. We need to be fearful of sex workers. We need to be fearful of Black people. We need to be fearful of mad people. And we need to resist and rebel with everything that we have at this moment and say, actually, you're not in charge anymore. You know what? Like, you've just proven how irrelevant and useless you are. This crisis has illustrated how completely unnecessary you are in our society. And so here we go, guys. This is it. This is the beginning of something completely different. And I can't wait to be part of this revolution with you. That's all I'll say.
That was beautiful, Syrus. I needed that. Thank you so much. We've had to rejig the I've had to rejig the schedule a little bit on the fly. We'll wait till the end to have questions. Robin Maynard actually can't make it because she was at the press conference for the hunger strike in Laval. If you check out the hashtag hunger strike Laval, you can get updates about it. But the press conference chat online was overtaken by some racists, so it was delayed, and they had to delay it for a while. And now she's working, interviewing some people who are part of the migrant strike, hunger strike in the Laval institution. So she's not able to join us, but we're going to have up next, one of the things that I think a lot of us, in relation to these emergency powers that are being enacted, is these laws that some of us might not know as much about as we do potentially about criminal law. And so we wanted to have someone come and talk to us about public health powers and how they've been used in context of other communicable diseases, so we can articulate resistance to those laws. So I'm going to invite Colin Hastings to come and present now about some of his work in relation to doing a scan of public health laws across Canada.
Great. Thank you, Alex. I just want to start by saying that I'm really grateful for the opportunity to be part of this discussion this afternoon, and really grateful for the chance to learn from and organize alongside you all in relation to the policing of COVID-19. Thank you, Alex, and everyone who helped to bring us together this afternoon. I know that doing this kind of coordination is a ton of work, and we all really appreciate your efforts there. So thank you for that. And thank you so much to all the speakers who have shared some really incredible thoughts so far today. So as Alex mentioned, the main issue that I want to reflect on are some of the lessons that we've learned about public health law while organizing against HIV criminalization, in the hopes that these sort of lessons that we've learned can support our efforts to anticipate and coordinate resistance to the policing of this current pandemic. And the main issue that I want to focus on is this sort of tension that arises when we're mobilizing against criminalization, police, and public health. So before I discuss public health in more detail, I just want to echo some of what Alex mentioned off the top, that I sort of arrive at this discussion recognizing that COVID-19 is a very serious public health issue, and that an effective public health response to this pandemic will save lives. So I'm not here to just sort of openly bash public health, that we should recognize that public health measures are important for protecting health and preventing disease, and in particular are important for protecting the health of vulnerable populations, people living with HIV, people who are immunocompromised, people who are homeless, people who are incarcerated. So to sort of hold that public health interventions are important. But as Sandra mentioned a few moments ago, this doesn't mean that we should give public health a free pass. And we need to pay attention to and be really vigilant about the types of measures that public health introduces throughout their response to COVID-19. So in the movement against HIV criminalization, our efforts for years, and for many reasons, focused almost exclusively on resisting the use of the criminal law in response to HIV. So this work to get HIV out of a criminal justice framing, out of the hands of police, takes the form of mobilizing arguments, sometimes about how the criminal law undermines public health efforts by creating barriers to testing or HIV care and treatment, highlighting how the criminal law response is often out of step with scientific or medical evidence, and of course showing that criminalization disproportionately impacts groups that are already heavily marginalized, stigmatized, and criminalized in society. When we make these kind of demands to limit the use of the criminal law to respond to HIV, it can sometimes take the form of sort of promoting a public health response. So one might propose, for example, that public health regulation is a more favorable, less intrusive, less coercive, less stigmatizing alternative to criminal legal intervention, and then sort of end up organizing around this claim that goes something like, HIV is a public health issue, not a criminal justice issue, it's not a crime. And of course, it's imperative to strongly resist the use of the criminal law and police to respond to health issues. But at the same time, what I want to emphasize is that we have to be really, really careful about what we wish for and to be incredibly intentional and very specific about what we're asking for if we're calling for a public health response as an alternative to police and criminalization. We don't often consider the tremendous coercive powers that public health agencies can enact under legislation. While public health activities sort of typically occur out of view or in the background, as many of us have mentioned already today, COVID-19 is a context that shows us the remarkable authority that public health officers can exercise. This, of course, looks different across different jurisdictions, and I'm sure people on the call can speak in more detail to how public orders are being used in the communities that they live in. But in general, what we're starting to see is an escalation in tactics from public health guidance or public health advice, which is the sort of public health activities that we're most used to seeing, reminders to wash your hands, to cover your cough, all those kind of good things, towards more authoritative and coercive measures that have to do with authorizing police to enforce public health orders that erode civil liberties, restrict movement, close public spaces, levy fines, and even impose jail time in the interest of public health. Alex offered a really nice overview of some of the ways that we're starting to see this policing enacted in different jurisdictions, and I know that there's a document that's circulating this as well. Most of my activism and research on public health has been grounded in Ontario, so I just want to use this context as an example to try to illustrate some of the concerns that I have about what a public health response to this might look like. So far, in relation to COVID-19, as Alex mentioned, public health has mostly been about closing public spaces, levying fines. However, it's important that we recognize and take seriously that medical officers can also, in Ontario, can also issue what's called a Section 22 order. And this order equips public health with really expansive coercive powers. So just reading from that piece of legislation, it says that a written order may require a person to take or to refrain from taking any action that is specified in the order in respect of a communicable disease. So that's quite an expansive power, and there are similar types of legislation in other jurisdictions. But basically what this means is that if a medical officer believes that there is a risk of a communicable disease outbreak, a section order can, for example, confine one to a certain physical space. It can widely publicize one's health condition. And if one is deemed to be non-compliant to a public health order, public health can apply for that public health order to be converted into a court order. So what this means is that when public health orders are not followed, there can be movement from public health to other forms of regulation and escalation of authority from public health to police and to provincial courts. So when thinking about the kind of demands that we might want to make, it is crucial that if we're calling for public health as an alternative to policing, as an alternative to criminalization, that we're doing so in very specific, very narrow, and very focused ways, and that we're thinking really deeply and really carefully about how these types of public health measures are going to come to bear on groups that already face heavy surveillance and social control. Another, I think, important lesson about public health that we've become familiar with around HIV criminalization is that folks will often advocate for public health responses to HIV non-disclosure on the basis that having HIV criminalized is highly stigmatizing. And of course, criminalizing HIV or any other health condition is a profoundly stigmatizing act. But I want to caution against promoting public health messaging as inherently less stigmatizing or less discriminatory. And in particular, we have to keep in mind that establishing deeply racist connections between one's health and or one's race and immigration status is a very old pattern in public health messaging. There is a long lineage of anti-racist scholarship and activism that shows that if a health condition is framed as a public health issue, such a framing is going to remain a catalyst for messages that produce racialized people as threats to the health of white populations, and that will be used to try to legitimize surveillance and social control, particularly of Indigenous peoples and African, Caribbean, and Black communities that are already subject to heightened surveillance and measures of social control every day. Just a couple more points I want to make before wrapping up. One, I think it's important to recognize that it can be really challenging to organize a response to public health. And this is one of the reasons for this is that public health tends to be really decentralized. In Ontario, public health is comprised of about 36 individual public health units alone. So this sort of decentralization can make it really difficult to kind of get at public health. A second thing I want to keep in mind, and again, echoing some really important points that Sandra made, is that we have to keep in mind that public health also includes people who understand themselves to be allies. And when you, in my experience, in our experiences, I think a lot of us working in HIV, is that when you speak to people who work in public health or you read public health guidance documents, they're horrified when their work is linked to policing in these sorts of ways. So as Sandra mentions, I think now is the time to seek out those sort of allies and to hold them accountable to those sorts of measures. So I'll leave it there and just want to say again, thank you so much for the opportunity to be part of this discussion today, and looking forward to talking more with you all.
Thanks, Colin. So I know it is for some people, if you have to go because the time is up for the original call, please do that. But for other ones, we'll continue this conversation for a while longer. I have a couple of questions that people have posted, but first I wanted to give time to Ted Kerr from What Would an HIV Doula Do to give us some comments about their work and organizing online to take care of each other.
Hi, everybody. I'll be really quick. It's nice to see so many faces. Everybody's lovely. I'm wearing a Joe Exotic shirt, as you can see. It's very animal print. I'm doing that for all of you. So What Would an HIV Doula Do was created a long time ago now, about 4 years. And basically, we know that doula is a role that's as old as humans are. They're people who help people in childbirth. And increasingly we've seen abortion doulas, end-of-life doulas, gender doulas. And then so I was thinking, as somebody who's been part of the HIV community for 15 years, what would a doula for HIV look like? And I left it as a question, and community has formed around that question. And now we have meetings, we have projects, and we understand that a doula is someone who holds space during times of transition, and that HIV is a series of transitions that start long before you get a test, after diagnosis, after you're on medication, after you decide to take a med break, after death, whenever. There's lots of transitions in HIV. And we doula ourselves, we doula each other, and something that Jessica Danforth helped us understand is that we doula systems. As we're doulaing ourselves in our community, we're changing the places that we live and work and love in. And so we think of ourselves as an abolitionist group. We think that we think of doulaing as something that is in community, with community, and is against police, and is against thinking that we need to go outside of ourselves to look for justice. As part of this, we've been doing work ever since COVID started. The main things that we've been doing is we're about to host our second Zoom discussion. The first one was called Let's Not Be Afraid of Each Other. And it was much like this. It was me and Ripley Soprano, and we hosted an opportunity for people to talk about their feelings and their skills and their fears. And what we understood from that is that people weren't finding the space or the time, either because of pressures or because of their own judgments, to talk about their feelings, and that actually it's okay to talk about fear. It's okay if you're not the hardest hit by COVID to say that you're scared, to admit that you need help. And from that call, we also learned, and lots of people on this call already know this, that for people living with disability, for people who are mad, for people who are socially isolated for other reasons, this moment in history is nothing new, and that lots of people have lots of skills in living and thriving within social distancing. And so while it's very okay for us to be complaining and figuring out how to live within social distancing, there's also so many people around us and among us who know how to social distance with flair, with panache, with love, with community. And so we should be working with them. We should be paying people who have these skills to teach us how to social distance with community, not against community. And we should be figuring out how to do that equitably. We're having another call on April 7th called Let's Dream About Space Together. Right now we have a very Western ableist, male-centric idea of what it means to take up space. And so what this moment is providing us is an opportunity to listen to First Nations folks, to listen to people with disability, to listen to people who are considered, you know, less than, and think about what could space look like, how can space look like. And so we'll be doing that. And then we're also creating a zine called What Does a COVID Doula Do? What does a COVID-19 doula do? And people have been submitting all the different things that they're doing or they're feeling. There's lots of anger, there's lots of rage, there's lots of confusion, and there's also lots of helpful hints. So something a lot of us have been talking about, like not calling the police and wondering what we can do instead. And I think one of them is thinking about, how do we talk to each other about fear? How do we talk to each other about what we're afraid of and who we're afraid of? And how can some of us begin to absorb? I can absorb a lot of people's anxiety. I don't know why, I'm like a Care Bear sponge. And I think, how can some of us actually take up some space and figure out, you know what, I hear that you are very scared that someone is going to lick the bread in the grocery store, and that is making you perpetuate a culture of fear on Facebook. But maybe instead of posting that, you can call me and we can talk that through together. I think there's all these ways that are not large scale things, but small, intimate things that we can be doing to be helping these everyday fears and these everyday opportunities of doulaship. I really like what Syrus said about everyday abolition. And I think that's the job of a doula, to hold space every day for times of transition. And culturally, we're in a time of huge transition. So I'm really excited to figure out how to change and transform with all of you.
Thank you, Ted, for that and for sharing about your work. Can you put a link in terms of how people get connected to those in the chat box? And just a reminder to everyone who wants to remain connected, because people might have to drop off as it gets later, but I'll keep some, you have some questions, but just a reminder to everyone to, if you're interested in remaining connected, the idea of this call was to kind of help ignite an ongoing response and keep people connected. So we have the email address, policingthepandemic@gmail.com. But I have a few questions from people that have been sent in to us throughout. The first one's for Elle Jones. I don't know, Elle, if you're still here. But the question is, do we have strategies for advocating immediate release from institutions where there will be an inevitable COVID case, as was just reported in Sherbrooke? They sent a link from La Presse. Is there a sense that releasing incarcerated people after such a case is reported in their institution will be near impossible? That's the question.
Yeah, I mean, the thing is, it's that catch-22. As long as there's no cases, we have judges saying, oh, we don't have anything to determine. So there's been, I think, a consensus on intermittent, so releasing those sentences or like not having them report. There's been, I think, a pretty good consensus on, release of low-risk people, like people who are near the end of their sentences. There's been, I think, some consensus on consent releases, so where the Crown and defense all agree. So those things have been successful. The challenge is then for everybody else, particularly people on violent charges, what the judges are saying is there's no cases, so, we're not going to treat this as an emergency right now. Like, it doesn't seem as though we have to do a release because we've not seen cases, but we know the minute that they see a case is going to be, we can't release into the community because you're going to be a vector into the community. So it's basically a catch-22 where until there's cases, it's not serious enough to release. And once there's cases, it's too dangerous to release. So that is our real fear, that they really will have no other measure. The guards can't search people, right? They're not even searching now. So at what point are the staff going to decide that they don't want to work because they can't search for contraband? They can also declare it an unsafe workplace and not report for work. So that's going to happen the minute there's an infection. The staff stops reporting. And once there's no staff, everybody goes on to lockdown. And then once that happens, people are basically held in effectively solitary confinement and constant lockdown, and nobody's going to want to release in case they travel it. So we're really caught inside this real problem with this, which is why I've been kind of advocating for release now. Is there a strategy? Is that the question? I mean, there's certainly, we've been advocating. I can share the advocacy letters we have. They're quite long. And they've been quite successful provincially. Federally, we haven't got as much of an answer, but we've been advocating for release. So that's all I can say is we've been advocating. But the problem again is that as you play games with government, and I always think that because the main thing is just this material, get people in the street, get as many people out as possible, like let's just do this. But that requires these kind of compromises that are happening when we're using language or so yeah, it always sets up a border of who's not included, and that's the problem with when you engage in advocacy with government, you have to use government language. The minute you use that, you've essentially conceded some ground, right? That there is such a thing as a dangerous offender, or it is somebody who's beyond these boundaries, or there is somebody that's a risk to the community. And it's very hard to then turn around and say, no, we mean everybody, when you've created this language of low risk and it's not a harm to the community. So the judge's letter I was just looking at in one of the decisions in the cases is, we have to balance the safety of the community. So the risk of people getting out with the risk of getting corona, so they're almost creating a connection between the risk from violence from these alleged violent offenders and then corona, and they almost become the same thing, and both of those things must be managed. So I think it's going to be very, very difficult. I'm not that optimistic, I have to say. I don't know. I mean, I'm optimistic in the sense of we've seen some really good things in terms of community releases. We've seen that when we want to do releases, we can, crowns that have actually worked to release people. But then we've also seen the reverse behavior. We've seen crowns writing letters and saying the jail is safe because they're giving them an extra bottle of spray. So I'm not that optimistic. Once COVID hits, I think we're really going to see a human rights huge issue in the jails, and not just of corona spreading, but particularly of the suspension of their rights. And I don't think there's any way around that. So I wish I could be more optimistic for that. But what I'm hearing from inside, what we know about how things have been handled in the past, what we know about the ways that prisons always refer to security, and everything always becomes a security risk. And of course, once something's labeled security, you're not even entitled to information about it. So I'm actually very, very concerned about the kinds of conditions, not just from COVID, but security conditions that are going to exist when we have cases. Does that answer the question?
I think so. I mean, I think it was from Jordan Arsenault. Jordan, did that answer your question?
Mute. If I could unmute myself briefly, yes. L. Jones, I wanted to thank you because I talked to someone in an institution in Quebec. I feel the exact same way, that once we have the Sherbrooke situation very briefly, where there is a case, then that will be used as an immediate excuse to not release anyone. And so I'm thinking about particularly my, Alex and I have a mutual friend for this weekly, bi-weekly call we have, and on a medium security, and thinking of strategizing ways to release as many of those people as possible, because that case will then become a weaponized reason to refuse any releases.
We've been experimenting with habeas. So if there is a case, people could immediately bring a collective habeas to the court. So do you know what a habeas corpus is? So it's an emergency application to the courts. They can fill them out. Of course, whether they get to the courts, whether the guards lose them, these are all questions, whether the court will be open to receive them. But we haven't, we've been contemplating that. So you probably have to wait until the very first case. And then if everybody did en masse a series of habeas applications, they have to be heard in the court, and that might at least provide one hearing. That hasn't been tested. We're also sort of looking for a perfect case for the habeas to get out on COVID, which is somebody without violence, somebody, that without priors, those kind of cases that aren't complicated by those issues. Because of course we know that once we start talking about violent crimes, and I don't believe in this definition of violence. To be clear, I have an abolitionist view of violence. Like, we understand that violence is coming from the state. Violence is done upon people. And this narrow definition that violence is, a black man with a gun or an indigenous person who stabs somebody or whatever, I don't ascribe to that. But that is of course what is happening in the situation. So habeas is one option, and maybe a charter challenge would be another option. So nobody's tested these yet, but those are some of the things we've been kind of kicking around in terms of how to maybe do a legal challenge.
One follow-up question to that, if I may, Alex and Alex. It is when you talk about about habeas corpus, are you referring to per institution, per province, or possibly Canada-wide?
I don't know how they do Canada-wide. I would say per range, really. So the institution could do it as many as possible. They could hear them all together. So individuals can file them, or you can, like, you all have to file kind of, you're on your own, but you can also just file together, like do 50 at a time kind of thing. And everyone could just fill out for the same conditions. It's quite simple. It's just getting it to the court is the challenge, because the staff tends to throw them out. So you really need somebody to call the court, check on it, maybe have them prepare 2 or 3 so that when they lose one, they have the next one ready to send. I can give you some more information on that, maybe not in this conversation, but we can talk if we need to talk about some of the processes that help with habeas filing.
I appreciate that. Thank you.
And Giselle Diaz posted in the chat that there's a new abolition coalition that a bunch of us are connected to, who are collectively working on decarceration strategies. And if you want to get connected to the listserv, it's in the chat. It's abolition-coalition at list.riseup.net. But it's in the chat if you scroll up a little bit to get connected to what's happening there. So we have one question from someone wanting to know about people who use drugs and being able to access drugs while in isolation, and if there's been any strategies or support around that. Wondering maybe if Zoe could speak to that, or anyone else with expertise could speak to that, if anything's been happening. I don't know if Zoe's still with us, so if she's not,
I'm with you. Hi.
Oh, hi.
Okay, so oh man, for people in isolation and quarantine in Toronto, they're supposed to be like supporting people, and they're supposed to be we're trying to push them to do safer supply, which is prescribing people Dilaudid and Cadian. They could also prescribe people fentanyl, which would be great, but I don't know if they would do that. And they could also prescribe people stimulants. Whether doctors do it or not is like the next challenge, because there are a lot of doctors who are like totally opposed to safer supply. So there is a group of addiction docs who like hate it so much, who like want, basically they just don't want people doing drugs. So they're very much into Suboxone and methadone, which, if people wanted Suboxone and methadone and lots of people are already on it, they wouldn't be using on top of it, or they wouldn't be like using like drugs that they know they could like overdose from, because people can get access to Suboxone and methadone. So it's really, really frustrating, because these people are quite vocal, and that they should be offered something so that people will stay. And also it's really dangerous to put people into withdrawal on opiates. So when there was talk of the liquor stores closing, everyone was like, no, that's an essential service. We can't have people going through withdrawal on alcohol. It's really dangerous. That is the same for drugs. So there's a lot of doctors who can get behind managed alcohol programs, which are like giving people alcohol on the hour, supporting people through that. They have a hard time with drugs. And it's really fucked up that they can be like, okay, we're okay with alcohol, but we're not okay for opiates or stimulants. So just to say that safer supply is happening across the country. It happens in Vancouver, it happens here in Toronto and in Ottawa and other places where doctors are prescribing. But if it becomes unclear, if people feel like they're not going to get supported, and they won't go to the hospital, they won't do it. And so the other thing is, like, I know in the network of my friends and I, because my friends like also are working and having a hard time getting drugs right now. Like, some of us have been lending people money and going to score for them so that they can make it to work and not be sick. So there are networks of people trying to help each other out, but like that is also not sustainable. There is a big fear that the drug supply will dry up and that it'll be a challenge for people to get what they need. And people getting dope sick is like not good. Even though methadone and Suboxone are something that are offered for a lot of people, they've tried this, or they feel like this is forced abstinence, and is against what they wish. So I'm seeing things in the chat, but I can't follow it. But I do think, I think we need to be worried, and I think we all, I know there's talk of I want to be optimistic, but I'm fucking terrified of the people I know, the people I support, the people I work with, my friends, my coworkers, not making it through this. And like, I am a person that wants to see the end of capitalism and wants to live a totally different way, but I want those people to be here with us too. And so I think like, while we're dreaming of that, we have to fucking fight for everybody. That's everybody in prisons and jails. That's everybody living in shelters and on the streets. And, you know, like, oh, there's someone commenting about withdrawal beds. Like, we in Toronto, St. Mike's closed. It's like new intakes to people who are going through withdrawal and in detoxes. Like, we got to make sure that detoxes are considered essential services for people, that people close their doors to starting new starts for OST, for opiate substitution therapy, which could give people some security if they need to get on it so that they can be safe. There's people who fought for like guidelines to change so people can get carries much longer. But again, it's up to the prescriber. So one prescriber, Dr. Lau, who works in Scarborough, he wouldn't give extra carries to his patient, even though that person has always pissed clean, because that man billed $1 million in 2017 to 2018 because the structure of providing this, like those people like put down drug dealers. What the fuck are they? They're the most capitalist in the way that they deliver services to people. And so they like, so he wanted to continue with urine drug screens because he can profit off people. I mean, I hope that when we're thinking and envisioning a new future, we think about like destroying this addiction treatment sort of paradigm and complex, because it's profited off people's lives. It's shit. They can't even agree on a definition of what quote unquote addiction is. And it's causing harm to people. It's so punitive. It is so like when we talk about abolition, this is one of the most punitive systems, and it is used as one of the most effective tools to continue the drug war. So I find it, I'm totally having a hard time with what's happening, because I am really fucking scared for people who use drugs and who depend on using opiates. And we have to continue that fight, and we need to really put pressure on people who prescribe. They don't need to get funding to write a prescription. Those people will make money off writing that prescription. They need to start writing prescriptions for people who need opiates. But also, to be clear, what capitalism has caused is a drug shortage. So while we're writing for Dilaudid 8s, which is what we're trying to give people, that we've also had a shortage of Dilaudid 8. We've also had a shortage of Cadian, and we also have a shortage of naloxone in vials. So, you know, this is what capitalism does because drugs are not a common good. If they were a common good, we wouldn't have these problems, because we'd also have PPE for everybody, which we also have a shortage of. So I think I'll end it there. But like, I think people are also, are trying to establish networks so that people can use safely. So people are FaceTiming with each other. There is a phone line in Ontario that's a 1-800 number from 10 to 10 where someone sits on the phone while you use. Unfortunately, it just sends EMS to you. But like, we do have to think of some creative ways. Like right now, harm reduction services might be really hard for people to get to. If they're quarantined and isolated, how do people get supplies? If mobile services are down, how do people get their drugs when their drug dealer is like afraid to sell them drugs? So we really have to start thinking of like really creative ways. We've been trying to organize in Toronto. We've been having calls like every week to discuss what the gaps are and how we can fill those gaps. And on Monday, we're having another call to figure out how we can like do some outreach into community. And we're all working, like lots of us have been working on the front line through all of this, just trying to figure out what we can do, how we can grapple with everything that's happening, and figure out some creative solutions. Also, Matt Bond and I are putting together information for drug dealers on how you can like reduce the spread of COVID when you're selling drugs to people, so that they don't get too scared about selling to people, because they got to make money. People need their drugs, all of that thing. So, and people are trying to support their own families by whatever reasons they have for selling. So yeah, we just need to be creative, and we also just need to not like, I'm just worried about people. So yeah. And also, if you have methadone doctors who are refusing to give people carries, or still making people come in to do urine drug screens or go to the pharmacy every day, put that person's name down. Take that name, let's make a list, and let's make sure those fuckers don't have anyone coming to their practice when this is done. They should not get, and no one should go to see them, and we should totally shame them and put them out there that they don't actually care about people. They care about making money, because there's so much money to be made, especially in Ontario, where you can charge like $12 for every urine drug screen, every blood test. Like, fuck those guys. Let's make sure that they never practice again, because they bill so high and we don't have that public for us to see, but we know that there's some of them making millions off the backs of people. Talk about who's a dealer, really. And if you're a drug user, lots of people will agree, they actually just give you a shitty drug, because really what you want is the drugs. Okay, thank you. With the pleasure.
If I can just add something really quick to that last point, I think that these doctors and nurses and other people that are complicit with all of this, we need to also stop inviting them to our conferences and stop partnering with them on research. We need to just blacklist these people from everything, because they're getting their legitimacy and their reputation on the backs of the communities that they're profiting off of. So we need to do that. And sometimes I do that, and other people in the community think I'm too mean, or that I'm like taking it to an extreme, or that we need these people because they're also allies. Well, I think we need to hold people who want to be allies and want to pose as allies. We need to hold them to a much higher standard than everyone else.
Definitely, it reminds me of Robert Remus, one of the AIDS AIDS surveillance doctors who community would protest at conferences, because he would testify as a prosecutor in HIV criminalization cases. At the same time, he was the person who had every HIV case under surveillance across Canada, and people invited him to all the conferences as a result of that. But he kept testifying over and over again in HIV criminalization cases to put our friends away in jail. And so we protested him at conferences. And I have one quick question, and there's still 85 people on the call, so we can still keep talking for a while. I want people to know that we will follow up and hopefully have local or regional conversations or topical conversations. We have to figure out how that will happen. And there are people who want to create a kind of monitoring form, so we can actually start keeping track of how COVID is being criminalized or policed on the ground. One question about violence that came in and was directed towards Elle, but towards other people. And so specifically around the idea of violence being defined or connected to the state, or being something that is enacted from the state onto other people. But people are concerned also at the same time that under quarantine, there's going to be an increase in domestic violence and violence against women and child abuse. And so how do we contend with that, opposing police violence, but supporting those people, potential increased violence under quarantine?
Yeah, and so, I mean, the first thing to understand is, of course, many of the conditions of violence obviously patriarchy causes this, colonial violence causes this. That doesn't mean people don't have accountability to the personal and intimate violence, they do. But we also recognize that this takes place in a violent society. So my point of my comment there was that, we'll have a reading of violence that says, this person is committing violence, but then we don't read, of course, the police is violent. We don't read as this bailout to the corporations while, people lose their businesses as an act of violence. We don't read, like keeping people in prison while COVID is spreading as violence, right? So we have this incredibly narrow view of violence that reads it as entirely committed by individuals and ignores all the forms of state, patriarchal, racist, colonial violence that influence us every day. With that said, obviously the challenge of abolition is exactly this question, right? So how do we both, hold abolitionist viewpoints, which is sometimes theoretical, and then in practice, what do you do if, your friend is being stalked by a man who won't stop, who won't obey orders, who won't do these things? And like at that point, you don't say, don't call the police if that's what you think is going to make you safe. That person may well have to call the police if that's the only option they have right now. But what we understand is that is not the best option that exists to us. We can do better than that. It's just that that option hasn't existed, right? So I think we're always balancing what we have on the ground, and we recognize that, yeah, if somebody's trapped in an apartment with somebody that's causing them violence and they feel that they need to call the police in order to keep themselves safe, it would be very irresponsible and unfair and victim blaming to tell that person, you can't do that thing. Like, don't call the police, just stay there. But we also know that the police have never solved violence in any systematic way, and that we are not going to address issues of gendered violence, sexualized violence, racist violence, the violence that's done in our homes from parents to children, we understand that that reflects the way that violence is constructed beyond us, right? That parts of the reasons why people do violence often tied to trauma, but then also tied to narratives about violence that exist. When we live in a society that holds up, you know, action movies as a source of power, a society that shows you that Donald Trump gets to flex on everybody, you know, so what do we understand as power? What do we understand as these things? How do those narratives affect us, and how do we internalize that? So abolition work isn't saying that violence doesn't happen, or that, you know, we have the best options for harm right now. It's saying that we know those things aren't preventative, they're not permanent solutions, and we need to work on what that looks like. And that's really hard daily work. We're not ready for that. Would never claim that, you know, we're ready to deal with violence. We can't even deal with it like in our own friend groups. You know, we have predators in our progressive communities that are here operating completely unchecked, and nobody wants to stand up to them, and nobody wants to enforce any boundaries of them, and everybody feels bad for them, right? That happens to us all the time, and we know that. And we know that privilege is also enacted in things like abolitionist groups and progressive groups, where we're constantly like falling into these same traps, right? So I always ask us to do that work of saying, you know, if we want a society beyond prisons, then what work do we have to do on a daily basis to learn how to hold each other accountable? What does community account look like? If someone does us harm in our communities, if we don't go to jails and prisons and police, which I don't believe are ultimately the solution, but that doesn't mean just letting people get away with it. It means we have to figure out what that means. And some of that is some of our ancestral ways that we had of holding people accountable within African or Indigenous communities. We had methods to do this. Some of this is building new worlds around this, thinking out those conversations. So I guess I'll just say this, I know I'm talking a long time, but I think abolition, we don't talk enough about the gray areas. I think we often just present it as kind of, it's a done deal, like I'm an abolitionist. And in fact, in practice, everyone who's on the ground has these issues. You know, do I deal with dangerous sex offenders? Like, what do I do when that's on my plate? You know, do I feel comfortable with that? What do I do with the child rapist that I have to deal with? You know, we all ask these questions. We've all encountered the cases where we're like, I don't know if I feel super comfortable with that person. We all are like, fuck R. Kelly, and I don't really fuck what happens to him, right? Like, everybody encounters those moments. Those are natural. And the thing isn't to deny them or just to pretend that we have an ideology that carries us through. It's to really think about them and allow ourselves to engage in that complexity and think about, how are we going to deal with this? And how can we be honest about the times when, you know, we feel vindictive, the times when we want punishment, the times when we just have to appeal to when we've maybe had to call authorities, like all of those things I think are really important in the discussion. So I don't have a good answer that's like the perfect answer. I think people obviously need to take the measures they need to do to keep themselves safe. And I think we cannot continue to use those things as stumbling blocks to doing the hard work, to think past it, to be like, oh, well, you know, murderers will walk the streets, so we can't, right? Those are always the things that are put up in front of us, and we have to be really willing to do that hard and complex work to make those mistakes. And we also have to, I think, finally engage with people that have committed harm. People in prisons that are there for things like multiple murders and shootings have a lot of insight and understanding in how transformation works and how accountability works and what remorse looks like and what is, you know, they're not just sitting there not contemplating these things. When you talk to them, they have very clear ideas and have done a lot of work. And they're some of our best sources in talking about, you know, what happened, why did this happen, and how do we change that? So I also think we cannot, and this is what happens when we just create this idea of violence, is then those people get excluded from the very conversations that we need to be able to have. And the final thing I'll say is, with that said, obviously, again, I'm a Black woman. So like Black women are highly victimized. I would never ask like a community of Indigenous woman to, you know, do the work of like, oh, you know, it's your job to go and forgive, you know, murders. Like, it's not the job of Black women who are being suffering violence to necessarily take on that work of let's also rethink domestic violence, right? Like, it is not the job of people that are experiencing harm from these things. We cannot put that expectation on them to also somehow, you know, spend time doing this if they are not already doing it through their own choices, right? So I think that's also really, really important, and that's what makes it complex, so that you can both work with the person that's caused the harm, but you also have to recognize that, like, you cannot make that demand of somebody to be like, oh, well, why have you considered abolitionist approaches at this point, right? Like, but we can do that in a communal way that offers people those options, and as we build those, I think we've seen very successful interventions. Third Eye Collective does this kind of work. There's a number of abolitionist and transformative justice collectives that work very hard on this. Sorry, that was a super long answer. I'm so sorry.
No, sorry. That was a beautiful, eloquent, and nuanced answer, which is what we need to questions like that. And the gray area is important to talk about. There was a bunch of questions that went by, and I'm pretty sure that they got answered, but I'm not sure if I'm missing anything, Alex. that we could jump in before kind of wrapping up. Just to let everyone know again, if you want to stay connected, send an email to policingthepandemic@gmail.com. And put any final questions in the chat and we can address them. From here, what will happen is a summary will be of our meeting today will be put together that we can hopefully use to help develop and articulate some language. I think there's been many beautiful things said today that can help us understand how to address and respond to COVID and the ramp up of policing and authoritarianism. And so hopefully that we can develop kind of a common language from what from the wise words of the people that spoke today around how to do that, or how to do that. And then and we've also said this will be an ongoing conversation. I'm not sure what that will look like or how that will work. It would be great if local people in local groups or local in their regions wanted to meet and talk, because there's specific things we need to focus on in specific regions. We might also want to have some population or topical specific groups discussing stuff, but I'll put out some proposals based on notes to everyone who responds to the email or sends an email to policingthepandemic@gmail.com, and then we can kind of figure out what we want to do from there. Obviously, this is an open thing. Want people's engagement and proposals. So, and I'm not someone who wants to run anything in particular. I was just angry and upset with the ramp up of authoritarianism and policing, because I've seen how it's hurt my friends living with HIV, and I just don't want more of it. So anyways, I think this seems like we should wrap up because there wasn't many other questions that came up. But thank you everyone for this really vital and powerful conversation. I think this was kind of something that I personally needed, and I know a lot of other people needed as well. So thank you for this. Sending lots of love to everyone, and we'll follow up to everyone who sends an email to policingthepandemic@gmail.com with next steps. Much love.
Thank you, everybody. And thank you. Everyone was amazing. It was so helpful. Thank you.
Very helpful.
Thank you.
What's your dog's name?
Baxter.
Ah.
Tell Baxter to keep it down.
Guys, he like ate 2 socks. Like yesterday, he like shit all over my house, threw up. He's so little, and he swallowed 2 socks. Like he barfed them up, and I was like, "What the fuck? You 2 socks? Like 2 socks?" Oh my God. He's like my old dog who used to eat everything. Like it's so freaky.
Wow.
The fucking puppy.
Okay, bye.
Bye, everyone.
Bye.